A man finishes a morning run, 10 kilometers. Strong pace, steady breathing. His heart feels powerful, but inside his chest, something else is happening. A silent blockage has been growing in one of the arteries that feeds his heart. Slowly, quietly, for years. He has no symptoms, no chest pain, no warning. And yet, at any moment, that hidden blockage could stop the blood supply to the most important muscle in his body. This is one of the most disturbing truths in cardiovascular medicine. A person can look incredibly healthy and still suffer a heart attack. In fact, for a large number of people, the very first symptom of heart disease isn't discomfort or fatigue. It's sudden cardiac death. How is that possible? How can the body hide something so dangerous for so long? To answer that question, we have to look closely at the system that keeps the heart alive. The heart is not just a pump. It's a muscle that works without rest, contracting roughly 100,000 times every day. Like any muscle, it needs oxygen. And to receive that oxygen, it depends on a network of blood vessels wrapped around its surface. These vessels are called the coronary arteries. There are two main systems supplying the heart: the right coronary artery and the left coronary artery. The left artery quickly branches into a large vessel known as the left anterior descending artery, often shortened to LAD. Among cardiologists, this vessel has a chilling nickname: the Widowmaker. The name exists for a simple anatomical reason. The LAD supplies blood to a huge portion of the left ventricle, the chamber responsible for pumping oxygenated blood to the entire body. If that artery suddenly becomes blocked, the heart can lose its ability to pump effectively within minutes. But what makes this situation truly dangerous is not the blockage itself. It's the fact that the body can hide it almost perfectly. Inside every healthy artery is an incredibly smooth inner lining called the endothelium, also known as the tunica intima. In its ideal state, this surface is almost frictionless. Blood cells glide across it like ice skaters on a frozen lake. But the human body is constantly exposed to stress. Over time, several forces begin to damage this delicate lining. High blood pressure pushes against the vessel wall thousands of times every hour. High blood sugar triggers chemical reactions that inflame the tissue. Smoking introduces toxins that directly injure the endothelial cells. Even decades of strong blood flow can create microscopic mechanical stress. Eventually, tiny injuries appear along the vessel wall. The body immediately tries to repair them. Low-density lipoprotein cholesterol, LDL, begins to accumulate at the damaged site. White blood cells arrive to investigate the injury. They absorb the cholesterol and transform into what scientists call foam cells. These foam cells pile up, layer by layer, year after year, until a deposit forms within the artery wall. This deposit is called atherosclerotic plaque. And this is where most people misunderstand what actually happens next. Most people imagine plaque like grease building up inside a pipe. They assume the artery slowly becomes narrower and narrower until blood can no longer pass through. That sounds logical, but the biology is very different. As plaque grows inside the artery wall, the vessel often adapts in a surprising way. Instead of shrinking inward, the artery expands outward. This process is called positive remodeling. The vessel stretches to preserve the open channel where blood flows, which means something astonishing can happen. A person may accumulate large amounts of plaque inside their arteries, while blood flow remains almost completely normal. They can run long distances, lift weights, climb stairs without difficulty, and feel absolutely healthy. For years, sometimes decades. But inside that artery, something unstable may be developing, because not all plaques are the same. Some are hard and stable. Others are soft, inflamed, and fragile. And those fragile plaques are the real danger. Imagine a blister beneath the skin. It looks harmless from the outside, but inside, it contains fluid and inflamed tissue. Some plaques behave in a similar way. They are covered by a thin protective cap, but beneath that cap lies a mixture of cholesterol, inflammatory cells, and debris. If blood pressure suddenly spikes, or if intense exertion places additional stress on the artery wall, that thin cap can tear. This is called plaque rupture. And the moment it happens, the body reacts instantly. The immune system interprets the rupture as a severe injury. Platelets rush to the site. Clotting proteins activate. Within minutes, a blood clot begins to grow. This is exactly the process that stops bleeding when you cut your finger. But inside a coronary artery, the same protective response can become fatal. The clot can expand rapidly until it seals the artery completely. Blood flow stops. Heart muscle cells begin to suffocate. And within minutes, they start to die. This is a myocardial infarction, what we commonly call a heart attack. But there is another way a healthy person can experience the same outcome, even without a fully blocked artery. Not every heart attack happens because an artery becomes completely clogged. Sometimes the problem is simpler. The heart suddenly demands more oxygen than the arteries can deliver. Imagine an artery that is partially narrowed, perhaps 50% blocked by plaque. While resting, this may cause no symptoms at all. Enough blood still flows through the vessel to meet the heart's needs. But during intense exercise, everything changes. Heart rate increases. The muscle contracts faster and harder. Oxygen demand skyrockets. If the artery cannot increase blood flow quickly enough, the heart muscle begins to starve for oxygen. This condition is known as ischemia. When heart cells die during this process, they release a protein into the bloodstream called troponin, one of the key markers doctors use to diagnose heart attacks. The person may simply feel strange, weak, nauseous, lightheaded, symptoms that are easy to dismiss as dehydration or fatigue. But the heart muscle is already under threat. Despite all these dangers, the heart does possess a remarkable survival mechanism. When an artery slowly becomes narrowed over many years, the body sometimes builds an alternate pathway. Small blood vessels grow around the blockage. They connect neighboring arteries together. This network is called collateral circulation. Think of it as a system of side streets forming around a blocked highway. These small detours can partially restore blood flow to the threatened region of the heart. In some cases, they provide enough circulation to keep the tissue alive long enough for emergency treatment. Exercise appears to help stimulate the development of these collateral vessels. By repeatedly increasing the heart's oxygen demand, physical activity encourages the body to strengthen its backup roots. But even these adaptations have limits. Because when a heart attack begins, time becomes the most critical factor. Cardiologists often repeat a simple phrase: time is muscle. After about 20 minutes without oxygen, heart tissue begins to suffer irreversible damage. And the longer blood flow remains blocked, the more permanent that damage becomes. Heart attacks rarely appear out of nowhere. Most of the time, the underlying process has been developing quietly for years. Plaques form slowly. Arteries adapt. The body compensates. And everything appears normal until one unstable moment changes everything. Which is why the idea of a healthy heart attack can be so misleading. The heart didn't fail suddenly. It had been under silent pressure for decades. And the only reliable way to protect it is not guessing that everything is fine. It's understanding what may be happening inside the arteries long before symptoms ever appear. Because the most dangerous problems in the human body are often the ones you never feel, until the moment they can no longer be hidden.